This is Dr. David Green, CEO of the Arizona Pain Network. The topic today is what you need to know about lumbar sympathetic blocks. A lumbar block is a procedure used to relieve pain in the lower extremities from several neurologic or vascular conditions. The sympathetic nerves come out from the spine and regulate a lot of activities that are behind the scenes, such as activating sweat glands, dilating blood vessels, the fight or flight phenomenon, and these are all called the autonomic nervous system. Okay, so this is the front of the spine. You can see this is the iliac crest here. This is the middle of the lumbar spine. This is where the sympathetic nerves in the lumbar area are. All right. So who does well with the lumbar sympathetic block? It actually works extremely well for those with RSD and CRPS, which is reflex sympathetic dystrophy and complex regional pain syndrome. You can see this is a patient who has really bad RSD, a lot of skin changes, redness, inflammation. For this patient, they probably can't even wear a sock because it's so painful. Okay, phantom limb pain does well. Post-herpetic neuralgia, shingles, those with cancer pain, pelvic pain, and if you have non-operable peripheral vascular disease. The procedure is performed as an outpatient. The patient lays on the stomach on an X-ray compatible table and usually receives some IV sedation. The procedure can be done unilateral or on both sides if necessary, and fluoroscopy is used, which is real-time X-ray guidance. So what you see is the needle is placed behind the spine, down where the lumbar sympathetic ganglia and nerves are. There's the spinal cord here, so you're really nowhere near that, but you want to go around the spine. When the needle is accurately placed, the pain doctor will place a dye to make sure that it's not in a vessel and that they're satisfied with placement, and then in goes the numbing medicine along with some steroid medication. Also, they can use phenol, which is a form of alcohol that can give longer term pain relief, or perform a radio frequency ablation, which involves thermal energy. Here you see a picture of the patient laying on his stomach and then the needle going around the whole spine to the area where the lumbar sympathetic chain is. If in fact the symptoms are bilateral, then you probably put another needle over here and come down. Are there risks? Yes, there are, but they're small. There's a small risk of infection, nerve injury, bleeding, anesthesia, allergy, temporary numbness. Rarely a dropped lung can occur. Usually patients right away notice increased temperature in the leg and the veins feel full on the side the procedure was done. This is normal, and that means the block was done correctly. A temperature increase in the one leg of 2 degrees Celsius denotes a successful block. The outcomes that have been shown to be excellent for those suffering from RSD and CRPS. Oral opiates do not often help with these types of conditions, or you have to take them in very high doses, so you can get constipation, addiction, tolerance issues. So for other conditions, such as post-herpetic neuralgia, whatnot, there are small case studies showing that the blocks work extremely well for those too. Arizona Pain is the top pain management clinics in the Phoenix metropolitan area, with valley-wide locations accepting over 50 insurances. The docs are board certified. They've won the Patient's Choice Award 5 years in a row. The number to call for treatment is 602-507-6550, and visit us online at ArizonaPainNetwork.com. I'm Dr. David Green, CEO of the network. Your pain stops here.